What should I really eat? If you are a kidney patient, then this question might have bumped into your head number of times. And you are not alone. This question worries many kidney patients. But making the right decision is very important, as what you eat can really make a huge difference in your health. So hello everyone, I am Dr. PURU DHAWAN. Welcome to today's video, and today we are going to dive deep into a very interesting and helpful topic for you all, the diet for a kidney failure patient. As kidney failure patient, you might wonder which protein is good or bad for me. Can I enjoy fruits and vegetables? How do I reduce my creatinine? What should I eat to keep my blood pressure in control? And a lot more questions might be there. Today, I will answer all of these questions in detail. Stay with me till the end, and you will get the full picture of what to eat and avoid, which will really help you to manage the kidney health and also help the patient to gain a speedy recovery. So, starting with the basics. What happens when someone's kidney starts damaging? The kidney performs a crucial function of filtering and removing the waste out of the body. But when these filtering units function improperly, then the waste is no more filtered. The result is high creatinine and high urea levels in the body. Along with these waste products, there are some electrolytes including sodium, potassium, phosphorus, which starts collecting in the body, as these are also not filtered by the kidneys. All these factors lead towards worsened condition of the kidney and might create a lot of serious health issues if not treated timely. So it becomes crucial to have a diet which can help in management of the nutrient level and also reduce the waste production in the kidney patient's body. So let's first talk about creatinine. What is creatinine? It is a waste produced as a result of the muscles breakdown, which gets removed continuously by the kidney in a healthy person. But if talking about kidney patient, then easily one can find high creatinine levels in their blood test report. And these high creatinine values very highly impact the working of kidneys. So what to be done in such cases? To stop the further kidney damage, the creatinine level need to be reduced, and for that you have to reduce your protein intake, as this is the nutrient solely responsible for the creatinine production. But now let me tell you guys an interesting fact. The human body consists of 15 to 20% protein, which means it's an important material forming your hair, skin, nails, and even your eyes. So we can say that both excess and lack of protein are harmful. Therefore, it is important to balance its intake, keeping in the mind certain tips, which I'm going to tell you now. Avoid the heavy animal protein like red meat, fish, chicken. Also avoid the dairy products like cheese. Instead, switch to plant-based protein like lentils, legumes, and pulses. These are light on your stomach, easily absorbed, easily digested, and results in less creatinine production. For example, you can take a bowl of thin dal or legumes or a glass of milk in one day for your protein needs. It is more than enough, and this will not burden your kidney also. The next metabolic waste generated in the body is urea. Urea is a nitrogenous waste produced by the liver during food metabolism. In a kidney patient, urea gets accumulated, resulting in many problems like nausea, headaches, vomiting, and so on. So to reduce the urea production, what do you have to do? Cut off the heavy, oily food, because your liver has to work twice as hard to process that. And when your liver works harder, it produces more urea. Instead, go for a simple meals like chapati, breads, plain rice, and light dals. This way, your liver produces less urea, easier for your kidney too. I hope the concepts are clear to you now. Till now, we talk about urea, creatinine, both of which are waste products generated in the body. But now we are going to talk about the nutrients, not any waste product. You all must be thinking that nutrients are always good for us, then why I am discussing them? Actually, nutrients are good, but only when they are in the right amount. And these nutrients become really harmful when the levels increases in the body. So let's talk about first nutrient, and that is sodium. Kidney failure patient needs to stay cautious for this. In a kidney failure patient, the high sodium levels can cause swelling issues in legs, under eyes and some other part also. Also, it can put lots of stress on the kidney and heart might also suffer due to this. So what are the things to be avoided for limiting sodium intake? When we talk about sodium, the first thing which comes in the mind is common salt or the sodium chloride. Many patients ask me, can I still eat salt if I have a kidney issues? My answer is yes. If your blood pressure level is in under control, you can use a pinch of common salt. But if you have blood pressure issues, being a kidney patient, then you need to stay on salt restricted diet. Interestingly, many people think that they can consume low sodium salt in normal quantity and this won't harm their kidney too. But they are not aware that the low sodium salt contains added potassium, which will eventually raise the potassium level of the kidney failure patient, and this is really harmful for a kidney failure patient. So avoid the low sodium salt. Now, the loss of appetite is a very common issue found in the kidney failure patient. As due to lack of salt, the patient finds the food tasteless and they don't feel like eating anything. So I will tell you now a special tip to solve this issue. The kidney failure patient can take natural spices like cumin, coriander powder and asafoetida for taste. These spices will not only enhance the flavor of the food but are also safe for the kidneys. And of course, avoid pickles, processed foods or tasty dishes like instant noodles as these they have got hidden salt in them. Moving on now, let's talk about the next nutrient which is harmful for the kidney failure patient, and that is potassium. Potassium helps in regulating the nerve and muscle functioning in the body. But too much potassium can be lethal for kidney failure patient as it can cause muscle fatigue, which might result in heart attack also. Apart from this, it can cause nausea, weakness also in a kidney failure patient. So to avoid all these situations, you need to avoid certain potassium-rich foods. Let's now discuss them one by one. First are the brown rooty vegetable like potato, sweet potato, beetroot, etc. Next comes the green leafy vegetables like spinach, lettuce, parsley, coriander, as these are fully loaded with potassium. One can use them in a form of garnishing or dressing, but never use them in a form of curry or smoothies. If I talk about the fruits, then you need to stay away from banana, kiwi, coconut, avocado. Also, you need to avoid citrus fruit like mango, grapes, and oranges. In place of all these, you can have chiku, apple, guava, papaya, but that too in a limited quantity, and no fruit juices. Juices have concentrated potassium, which makes them dangerous for a kidney failure patient. Please keep making notes of all these things so that later on you can refer to them to prepare your diet chart. Next, avoid jaggery. Alternatively, you can take refined sugar if you want to eat something sweet. If all these food restrictions also not help in reducing your potassium level, then you may have to go for leaching, a special process which can help to extract out the potassium from the food you consume. But please note here that only go for this process if it is very much required, otherwise don't. The reason is when you do leaching, it removes potassium, but along with that, other nutrients also get removed. And due to this, the patient might face severe deficiencies resulting in health issues. I hope you have understood the video till now. So moving on, let's talk about the next nutrients, phosphorus. Imagine a slight injury creating a major fracture in your bone. Isn't it scary? Yes, the same situation can happen with a kidney failure patient having too much phosphorus in their body. But why? What's the reason behind this? Actually, phosphorus got a special ability to replace the calcium present in the bone. So when the phosphorus increases, it gets filled up with the bones and makes the bones weak and brittle. That's why kidney failure patients are usually at a high risk of fractures. So to avoid this, there are some foods which you need to avoid strictly. Firstly, dairy products like cheese and yogurt. Next, the processed food like chocolates and soft drinks. Next are the heavy proteins like non-veg food items, chicken, fish, and etc. Some special medications called as phosphate binders might also help in managing the phosphorus levels. But make sure to supplement these medications like vitamin D and calcium too to ensure a good strength in your bones. Let's wrap up our discussion on the food and nutrition for a kidney-friendly diet. But as important as managing nutrients is, there is another key factor in your diet that we need to consider. Any guesses? It's a fluid intake. Yes, managing your fluid is just as crucial as managing nutrients, as it directly affects how your kidney functions. Let's see how it can be done. Patients often wonder that how much water is the right amount for me. However, the answer to this is not straightforward. Whereas drinking too much of water can cause fluid buildup, swelling in the legs, and even fluid buildup in lungs. On the other hand, if you drink too little, your kidney might find it too difficult to flush out waste and toxins, which can again boost up the creatinine level. So, what's the solution for this? Make it a rule to drink water in small sips, and that too about 100 ml at a time, and only when you feel truly thirsty. Avoid drinking large amount in one go, as this can overload your kidneys. Remember, your fluid needs may differ based on factors like climate and activity levels. So stay mindful, keep it balanced, and give your kidneys the best support possible. So we have covered a lot today, from managing creatinine to finding that right fluid balance. If you follow these tips consistently, you will definitely see improvements in your energy level and your overall health. I hope you have understood each and every detail about this special diet for kidney failure patient. Or if there are any doubts, you can share in the comment section below. And if you need more personalized help or want to connect with my team directly, don't hesitate. We are here to guide you through every step of your kidney care journey. Stay healthy, stay safe. I will meet you all guys in another video with more such helpful content for you all. Till then, take care, bye bye, and namaste.